So first of all, it's really important to know the symptom of asthma. If you don't realize that your students are having an asthma reaction, then you can't respond effectively. So you want to know not only what the symptoms are, but you want to know which students in your class have asthma, and to be sure that those students do have a relationship with a nurse, so they have an asthma action plan, and so that when there is a problem, there is medication waiting for them in the nurse's office. So those are things that ideally a parent would set up with the school nurse, but often that is not the case. So it's really important that you recognize coughing, wheezing, and other types of symptoms that may indicate an asthma attack. And so once you know who has it, and you know, you also need to know what in your classroom would set off an asthma attack, and the kind of things that happen in schools are curriculum products that you use, whether it's science or some of the art programs have chemicals and hazardous products that would set off an asthma attack. Just things like kids sitting on a rug if they're dusty and old, or moldy, those could set off an asthma attack. So we recommend that you have washable throw rugs that can be either thrown away or thrown in the washing machine and washed, and that all the products, whether it's personal care, cleaning, or curriculum, be non-toxic. And to be very careful about any kind of disinfection in the classroom, because most disinfectants have what we call asthmagens that could cause or trigger an asthma attack. So you want to be very careful about the type of products that are used, but you also want to make your room cleanable, because dust will also trigger an asthma attack. So if you have a very cluttered classroom and the custodians can't come in and clean, then you're creating an environment where asthmagens can build up. And also any pets in the classroom need to be managed effectively. And we recommend that if you have a student with asthma, that you don't have any furry pets in the classroom. And lastly, you want to just make sure that if a child does have an asthma attack, that you are prepared to help them get to the nurse in time, and make sure that that parent is informed. So as a teacher, you're responsible for both knowing, I think, who in your classroom could possibly have an asthma attack, the kind of things that you do that you could prevent an asthma attack, and lastly, how to help a student once they're in the throes of an asthma attack or you suspect they're having asthma.